Asking for help. Asking for help seems like a simple concept. If you cannot cope on your own with the problem or issue at hand, you should seek help from those who can best help you, either people close to you or professionals. However, it is not as simple as it seems. There is always an internal conflict. On the one hand, the successful completion of a task may rely on getting assistance, but on the other, it may threaten a person's sense of competence. Help seeking is composed of individual, psychological, cultural, social, economic, and political elements. Help seeking depends on the person's own individual history and self-understanding. Asking for help could undermine their own sense of self. Psychological elements such as trauma, depression, or anxiety. Cultural expectations and beliefs contribute to a person's help-seeking behavior. Numerous social and political factors and socio-economic background also affect a person's ability and willingness to ask for help. Asking for help in the context of migration. Migrants moving to another country are often tied to their own cultural background, and even if things work differently in the new host culture, they have trouble adjusting to the new situation. If you come from a culture where the norm is to cope on your own and not discuss your problems, this makes it difficult to ask for help in your new country. As an example, we can consider American versus Indian engineers. In American culture, it is considered disruptive to the workflow to ask for help, whereas in the Indian culture, asking for help is very common and it is seen as essential for their professional development. In especially northern cultures, men are less likely than women to seek help for health-related issues, such as depression, substance abuse, physical disabilities, or stress. In cultures where men are considered dominant and the head of the family, it may be difficult for women to ask for help from outsiders, as they are ashamed or in some cases even afraid to seek help outside the family. There are support networks available for migrants and refugees in many countries that make it easy to ask for help, even if it is only a matter of finding the correct information, lack of information due to language problems, and so forth. However, it is important to remember that many refugees and migrants suffer from more severe psychological symptoms and experiences involving mental health problems, such as anxiety, PTSD, depression, and others, that may be a result of trauma from dislocation, other previous experiences, or culture shock. Different cultures have different ways of dealing with guilt, shame, and fear. Some cultures are more shame-based and some based on guilt or fear. For example, most Arab and Asian countries are shame-based cultures, where honor is the most important value that must be preserved, and any individual failing in this will feel shame. This can lead to extremes, such as an honor killing, disowning children, and so forth. In some cultures, mental health problems have a particularly strong stigma attached to them, and thus are associated with shame and fear of being stigmatized. It is important not to mistake the experience of migration or dislocation for cultural difference. The experience of migration, the change, the adjustment, dealing with a new and unfamiliar environment may profoundly affect people's willingness and ability to ask for help. How can consultants best offer help to their migrant clients? Cultural sensitivity is something that is extremely important for everyone working with migrants. Cultural sensitivity refers to culturally respectful interpersonal skills and respectful communication, both verbally and non-verbally. A counselor or other professional must pay great attention to cultural sensitivity and exhibit empathy, patience, and understanding in order to create good communication with clients. When working with migrants, their cultural background and the norms and customs of their native culture should always be taken into account. These may greatly differ and affect the process of counseling. Personal factors should not be ignored either, as some people are more introverted and some more extroverted and expressive by nature or due to their experiences. People's experiences may differ greatly, and traumatic experiences or other factors may lead to mental health issues. Some useful advice for professionals when interacting with migrant clients are the following. Reflecting and understanding one's own cultural background, conceptions, and manners, and using this as the basis for understanding other cultures. Respecting diversity and cultural differences. Reflecting on the effect of one's cultural background and personality, behavior, and attitudes. Seeing clients as individuals. Being empathic and patient. Asking clients for more information about their cultural behavior instead of making assumptions. Using interpreters when needed.